Guys, I've got my yellow lights on here today because we are talking about something extra fun, and that is Foley catheters. But I'm so glad that you guys picked this video because these are some of the choices that you get to make in labor and delivery, and they're not so clear cut. Today, I'm going to show you a hidden choice that you can have in labor and delivery that can really help you feel a little bit more comfortable. And every unit kind of does this in their own way, but you can still make the choice of what works best for you. So today, I'm going to show you your two different options, when they're good, when they're bad, so you can make the choice for yourself when you're in labor. And I have to admit, in my 20 years in the labor and delivery room, I just did the thing that we normally did. I didn't give patients these two options. I wish I had, but I didn't. But looking at it, I kind of was taking what I thought would be the best for them and didn't allow them to pick on their own. That being said, sometimes patients are just deluged with too many choices. They just want us to make the choice for them. So if you're like, I don't care, just put in either one, that is completely fine too.
All nurses to the nurses station.
Okay, first off, what is a Foley catheter? It is a tube that goes up into the bladder. So this little tip gets lubricated and we slide it on up to the bladder through your urethra. And yes, that is an out hole for me, not an in hole. So not my favorite procedure. I think thinking about it is worse than feeling it, but most people get this when they have an epidural, and I like to make sure that my patients are good and numb before I'm putting it in. If they are putting in your Foley after the epidural and you're feeling absolutely everything, you need to tell your nurse and ask her to stop, because that shows the epidural isn't working. You could probably get up to the restroom if you needed to. So the most often time we use these is with an epidural, or you also get them in the operating room with a C-section. There are a few other times that you might get one, so it's just good to know about. Editor Hillary here. As I finished editing this video, I realized that I never discussed in here if you just want to refuse the catheter outright. And I think of that as a separate topic. I figure I'm educating you on the different options because there may come a point in time, even if you think you want to refuse it outright, that you end up needing one. And this at least tells you the different options. So refusing it outright, I actually have a whole post on my website about it. I'll link that one down below for you. But I just wanted to let you guys know that can be an option, but it might not always be the best option. So just knowing the other things in case you actually have to have one, and that can happen. So hope that helps. Now there are two different kinds. This is a Foley catheter, which is kind of what I've been talking about. It's the one that's most often used in the hospital. So this tube goes up into your bladder, and then we fill up a balloon. This catheter's a little bit old, so I'm always afraid that's gonna bust on me. We fill up this balloon with water. And then that balloon, which is usually bigger than this, I'm scared, keeps it in the bladder. So this part right here is inside the bladder. As you can tell, it deflates really easily. And then this part is in your urethra, coming out of your urethra. Your urethra is your pee hole, in case you were wondering. And then the urine drains down this tube into this bag. And then every once in a while, we empty the bag and make sure that you're peeing and all those different kinds of things. So that's the first kind of catheter. The second one, I don't have an actual one, but it looks just like this. It's just the straight tube. It doesn't drain into a bag. It is one that just goes in and then comes out. Does not have a balloon right here because it doesn't need to stay in the bladder. It just goes in and out. So those are the two different kinds. This is called an intermittent cath because we have to do it every once in a while. And the other one is called an indwelling catheter. And that's what a Foley, because I think the balloon is the Foley part. Now, I did want to say, if you were having a C-section, you get the one with a balloon that goes into your bladder, because during surgery, let me get my uterus over here. So if during surgery, the little buttons right here, your bladder were to fill up, your bladder is right here. And if it starts to fill up, it gets in the way and it could get nicked by a scalpel or something as they are doing the surgery. So it's really important that the bladder stay nice and small and not have any urine in it. So we have that tube up in there draining out the urine to prevent any issues with your bladder. We wouldn't during the surgery be able to go up and catheterize you. It's too much. So we have the indwelling one. Now, if you get out of surgery and you're absolutely hating the balloon, if you're feeling it and it's totally bothering you, then you can ask them to switch to intermittent catheterization at that point. Although usually that Foley is in just for a few hours after you have the surgery, so you're not stuck with it for a really long time. And I gotta say, some people with the epidural especially are like, it is a gift to not have to get up and pee. They actually really like having the catheter in, which you are probably sitting at home thinking that's insane. But it is really nice to get like a nice long nap without having to feel like you need to pee. So lots of benefits and cons with a catheter. And one fun fact about me is before I worked labor and delivery, I worked hospice. And one of my jobs with hospice was to go around to these old men's houses every month and change their catheters. So I got really good at catheters, especially catheters with an enlarged prostate. So that's one of my special skills that you didn't even know about. You just thought I was here for crocheted pelvis and baby. But I have more than that. Okay, so what do the studies show? So units tend to have one that they prefer. And when I'm in nurse groups online, I see people very adamant that one is actually better than the other. Today, I'm going to review the studies with you. A lot of people feel like that intermittent catheterization is better. Honestly, I didn't really find the studies to back that up. So the first study right over here shows that there was no difference between the two in infection rate. And then the next study showed that there was no difference in delivery time. Nurses sometimes have a concern that either the bladder is filling up or this balloon, which does get bigger than that, is going to keep the baby from descending into the pelvis, because just like in a C-section, your bladder is right in front of the uterus. And if it fills up, it can keep the baby from descending into the pelvis. So we like to make sure that you're peeing frequently if you're able to pee, or we're removing the urine if you're unable to pee on your own. So that study showed that there was no real difference between delivery time with intermittent catheterization or the indwelling Foley catheter. And then this one showed that there was no difference in postpartum UTIs. Now, that is one of the main things that we're worried about with the catheter, is that when we put it in, we're introducing some of the bacteria that are around your urethra and we're shoving those up into your bladder. So that's our biggest concern, is that we don't want you to have a UTI postpartum. Not fun for anybody. And so most of these studies are trying to figure out which way is better, to either put up the tube frequently or to have the tube sitting in there. Which one could cause more issues. And that study showed pretty much the same. Pro tip though, it's important to know that if you had a catheter during labor or postpartum, that you do have an increased chance of a UTI after delivery. So if you're starting to have symptoms, having to pee all the time, although right after delivery, you will have to pee all the time. So you might want to look for a few other symptoms. If it burns when you pee, or if you get in there and you feel like you have to pee all the time, but nothing comes out, those are things you definitely want to bring up to your provider so you can get on some antibiotics for a urinary tract infection. Side note, I might say UTI, it stands for urinary tract infection. That can also extend into a kidney infection, which we do not want at all. And finally, this other one also showed no difference in delivery times. So take it for what it's worth. I do not believe that one stands out as better than the other in this sphere, which is why I think we should ultimately give you the option. Now let's talk about the pros and cons of the different catheters out there. The first one I want to talk about is the indwelling catheter, the one that has the balloon. First off, this one only has to go in one time. So for me, the modesty issue of getting it done, I absolutely hate it because it is a prolonged procedure, where they're right down there in your lady bits. It's just not my favorite thing. So I love getting it put in and not having to deal with it again until it is out. So there is the one and done thing, which a lot of people may prefer. However, some patients may feel this balloon in their urethra, right? And I have had patients who felt that the whole time. So we pulled this out and then we switched to intermittent catheterization. And that little balloon can put pressure on the baby's head as it descends. So just like extra urine in the bladder can put pressure on it, so can this Foley bulb balloon. However, when you start to push, most places will deflate the bulb. As you can tell, it goes back down to nothing. They'll deflate the balloon so that baby can more easily pass out into the birth canal. And in the studies that I've looked at, there hasn't been a huge complication from this balloon that I have seen. But make sure that your nurse deflates that fully before you start pushing, especially if you're pushing for a long time. And when we deflate that balloon, usually it comes out. So they may actually need to do that intermittent catheterization if you're pushing for a long time to make sure that that bladder is out of the way. We do not need to push against it and our birth canal. Now, in talking about just the intermittent catheterization, which is just this, doesn't get the balloon, doesn't stay in the bladder, you may have to have it done multiple times. But the good news on this one is if you get your epidural and you're already like 8 centimeters, especially if it's like your second baby, you may only need one time of this. So it doesn't have to stay in your bladder. And that does seem like a really good option for me. On the converse side, even if you think this sounds better, if you are, only 2 centimeters when you get your epidural, it is likely that you're going to need to be catheterized for multiple times while you're in labor. One of the things I wish that there were studies that I looked at is kind of the trauma of us going in that out hole frequently. I didn't really see anything about that, but it is something that nurses are concerned about, along with us constantly cleaning, because before we put the catheter in, but kind of how long you're going to have it put in might be something that you want to consider as well. But either way, it really is your choice. The other thing I think a lot of nurses are worried about is we're going to get stuck in a room in an emergency or possibly with another patient, and we're not going to be able to come in and catheterize you, and then your bladder starts to fill up and baby isn't able to descend as well, along with possibly baby's head pushing on that bladder for a prolonged period of time. So if you choose to do intermittent catheterization, I realize this isn't your job, but I would encourage you to make sure that the nurse is catheterizing you at least every couple hours, or ask them how often they think that you need to be catheterized, to make sure that you're getting all of those fluids removed from your bladder. Sure, the nurse should be able to do it, but we're humans. Sometimes we make mistakes. Sometimes we get busy. So that's kind of one more thing that you need to remember if you want to have intermittent catheterization. Now, at some hospitals, that's just a standard of care. And if they do that all the time, they're probably in a routine of it. But if they usually do the Foley catheter, they might not be in as much of a routine. So that's just something to remember. And like I said before, the intermittent catheter, there is a chance that it's leaving your bladder too full. We give you a lot of fluids when you have the epidural. And so there is a concern that we're leaving your bladder with some urine in it and not emptying it fully and completely. The good news is hospitals have each on their unit. Both are used in different ways and in different times. Like I said before, the Foley catheter has to be on the unit for a C-section, and we actually use this intermittent sometimes postpartum. If people are unable to void, we'll put it up, get out the urine, and then take it out. It's not a fun topic, but I want you guys to realize that you do have choices. And this is just one very small thing, even though it might feel like a big thing, that you get to make the choice on for your delivery. This is just one of so many choices that you're going to make in labor and delivery. I have a whole video right here on the other choices that you're going to make during labor and delivery, so check it out. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.